I welcome all of you to IBM TV and to this show, which is Dr. Dhawan's live chat, and I'm your host, Dr. Sanjay Dhawan. I'm an eye surgeon practicing in New Delhi. The live chat is a show which talks about any and all aspects of life, any subject, anything that concerns the life or it improves its quality is what we will be talking about. How to plan for it, how to prepare for it. So we'll be talking about all of this. Looking forward to seeing all of you every Friday night, 9:30 p.m. to 10:30 p.m. Indian time. Thank you. Bye-bye. Namaste.
Namaste. Good morning, good afternoon, good evening, depending on wherever you are. Welcome again to yet another session of Dr. Dhawan's live chat on this Friday evening. We in India have been passing through a very deadly second wave of COVID, and for the past 2 weeks, we have been talking about the same subject. 2 weeks ago, we talked about the deadly second wave. Last week, we talked about how COVID is affecting children and is likely to affect them badly if there's a third wave. And so we need to take care of that right now. Today, we have another important subject at hand, and that is diabetes care and COVID. Because diabetes and COVID can adversely affect each other, and how to make adjustments for that, how to deal with the diabetes in this period for people who have got COVID or people who do not have COVID at the moment. And to talk about that, we have got two experts on our show. The first one is Dr. Sujit Jha, who is the Principal Director of Diabetes and Endocrinology, working at Max Healthcare, New Delhi. He holds more than 20 years of experience working in this field. He's not just a clinician, but also does a lot of research work on diabetes. He has even done some research work on the effect of vaccination and how the antibodies develop in the body after vaccination. So welcome, Dr. Sujit Jha, on this show.
Thanks, Sanjay. Thanks for having me on this evening show. Thank you very much. Very privileged to be here.
So how are you doing?
A nice evening. Oh, so far okay. So far alive. That's what you say in Delhi, unfortunately.
Yes, that's a big word nowadays, and to be alive is a big thing in Delhi. And
yes.
So the second guest is Ritika Samaddar. She's been with us earlier also. She's the head of dietetics, regional head of dietetics at Max Healthcare, holds more than 25 years of experience working in this field and specializes in diabetic diet and sports nutrition. So welcome on the show, Ritika Samaddar.
Yeah, hi, good evening. And great to be back in your show again, Dr. Sanjay.
Hi, Ritika, how are you doing?
Yeah, all fine.
So you're a veteran on this show now.
And it's a great fun to be on your show.
Yeah, so I know that you did a night duty last night and you're tired and still sleepy. So we'll let you sleep while Dr. Sujit Jha talks about the diabetes now.
Yeah.
Right.
So Ritika was an underage employed, 25 years experience. She was underage employed in Delhi. So just to let you know.
Yes, yeah. She's so young, She has got a daughter who's older than her, I think, but she's young, of course. Right, so coming to the subject, which is a very, very important subject, diabetes care in the COVID. So Dr. Jha, let us start with very, very basic that it is a common perception that diabetics are more prone to catching COVID. Is that true? And are they more prone to it or not? And do they need to take any special precautions to prevent it or not?
The answer is no, clearly no. There's no scientific evidence that diabetes, once you have diabetes, you're much prone to have infection. Even if you look at the wider thing, yes, there is always a risk of wider infections among patients with diabetes, influenza, but they present to doctors much more. They present to the hospital more. So that's why they are identified that they are much more common. They may have much more severe disease, but it's not common. And that's why we all know. So that's why we say, look, diabetes, patients with diabetes tends to present to the doctors more, but it's not known that they will catch infection much more.
It is believed that the immunity levels are lower than that of the normal population. Is that true? Or is it true only when the sugar is deranged?
I would definitely say, Sanjay, it's my personal opinion. I think sometimes diabetes are labeled wrongly to an extent that you need to have multiple of risk factors to be immunocompromised. Little bit of nephropathy, very long-standing diabetes, very poor control for years together. I would not say that somebody is a 45 years young man, HbA1c of 7.2, and say, look, you're immunocompromised, you're good. Yes, they are much worse than somebody who has no diabetes. But I would say that you need to have much more multiple complications like obesity, which they have, a poor diet and poor exercise, that make them poorly compromised. Otherwise, a clear, straightforward, though what is a clear, straightforward diabetes in real life scene is difficult, but in per se, I don't want to scare the whole world. Almost like 13 to 15% of the population would say, look, all your immunocompromised. I think I'd be wrong in saying that, but yes, they need to be extra careful than somebody else.
And it's also believed or said, and there's some videos going viral on social media which say that the virus feeds on the sugar in the blood, and so one should not eat any sugar at all in this time. No? And
so, Sanjay,
it does.
Yeah. So, Sanjay, your sugar is 90. I'm just saying, like, you don't have diabetes.
Yeah.
Bacteria don't need blood sugar 180 to feed up. It's the fungus infection which makes them much more prone, and the growth of the bacteria and the multiplications, and they can, So even if diabetes, the foot ulcers are common because you walk on the ground which has the largest number of 2% bacteria. So you don't need large number of bacteria. The kids, poor kids, get a lot of pneumonias. They don't need, they don't have high sugars. So I do not think it should be blamed. Yes, you are much higher risk, less immune compromised, the antibiotics tend to act less. But if you look at the large meta-analysis, I know a bit going scientific, is 1 to 1.2% extra risk of infection in patients with diabetes. But yes, I would say, yes, they are extra risk, but they should be more careful than somebody has more diabetes.
So do you think it would be fair to say that those videos which are going viral talking about do not eat sugar at all, and it's absolutely, I think, wrong and misleading, no?
Ritika to answer that. Ritika, answer that.
Yeah. So yes, I've also seen all these videos going viral where they say completely no to carbohydrate, give up carbohydrates and just have no sugars, no juices and all. So those are completely wrong. Yes, at the end of the day, we all need to eat a healthy, balanced diet. And especially for people who are recovering post-COVID and all, because of the various medications. And as of course, Dr. Jha said that, yes, if the sugars are a little deranged, definitely you need to look into your diet, what you're eating. And I would not say just have, a glass of juice every 2 hours just to make yourself healthy, because people have that notion that, if you're unwell, you keep on having juices and, you start feeling well. So yes, in that context, I would say definitely do not go overboard with your excess sugar content, but definitely having your sugar in your tea, or probably having a mithai, or as we were just discussing, if you want to have an ice cream, please go ahead and enjoy that ice cream.
So we'll come and talk about ice cream later on in the show. That's a very, very important subject for me. And so, Dr. Jha, is the disease, COVID disease, more severe in diabetics than in others, or is it the same?
Yes, that's absolutely correct. Mainly from the lung syndrome point of view, mainly for what we call cardiovascular disease. I must go back almost 16 months ago. If you would ask me, what's happening to the country? Almost 1/3 to little more than that. This is our data suggests that hypertension, they have diabetes. We have a longevity of 65. The Europeans have longevity of 85. I wish somebody would have asked me that question. Why is that? Because we are much younger population dying because of the NCD. By the time, anyway, we have a lot of infectious disease. The younger kids under 5 years mortality is anyway highest in our North India and other part of the country. But as far as extreme, the NCD, we have been anyway we are higher. We had a higher mortality. We tend to die early. So now, if it happens to a guy, I put a very crude mark. If you put a front of army jawans and army generals and majors and lieutenants, the chances that in the battlefield, the chance of General Saab is dying is much higher if you put in battlefield. So same thing, if you have diabetes, are people who are 80 years old compared to 60 years old in this unfortunately COVID battlefield, they're going to die more. But in India, that 60 and 56 years old tends to be behaving 10, 15 years older as such. So the community of the diabetes and cardiovascular, even if they don't have diabetes, they have metabolic syndrome, they're much higher incidence. That's why what we are facing the brunt of this COVID-19 overnight in last couple of weeks time and earlier as well, mainly because there's a driven force of diabetes, which is overt diabetes, obesity, cardiovascular disease, hypertension. So that's pushing the COVID-19 per se. But I would say that unfortunately, this was there before. This is getting more precipitated by the COVID-19, which is exposing our higher cardiovascular disease or background heart disease that we Indians are much prone to at much younger age.
So COVID is roughly divided into three phases. The first phase is that of the virus multiplication. Second is that of inflammatory complications. The third is the thromboembolic complication. So which phase does diabetes affect the most and why?
As far as the lung syndrome is concerned, the mortality is much higher on the based on admission glucose. We have a data to say that the entering of glucose, what glucose levels are. If you have 100 compared to 300, your even lung syndrome or the lung disease is much higher because your mortality is higher. I must add here, if you enter with any septicemia, any infection, forget COVID-19, this is almost like similar figure. I'm not saying COVID-19 is possibly much worse because we add a spice called steroids, which pushes sugar further up, makes the mortality much higher. But as such, any admission glucose, the blood sugar of a lung syndrome, the phase 2. The phase 1, people, I do not think that this has been reported at phase 1, the immune response tends to be higher. But definitely the lung syndrome mortality in that 7 to 12 days is much higher. When it comes to post-COVID, which is say 12 to 14 days, the cardiovascular thing is definitely much higher.
Okay. So the complications are more in diabetics.
Correct.
Right. So can COVID derange blood sugar itself?
Yes, any infection can derange your. I'm not trying to. The COVID-19 is not simple disease. It's created havoc, but any infection can precipitate diabetes, be it typhoid, be it malaria, or any infection. That's been known to all of us. But yes, definitely in COVID-19, who has not been checking. Mind it, the Delhi have a pre-diabetes population of something like 1/3 to population. So they're all coming with infections. They're getting blood sugar checked, having diabetes. But yes, COVID-19 has known to cause new onset diabetes, precipitate new diabetes, or a background diabetes which was not over.
Added to that is the use of the treatment, the steroids, which are, to some extent, life-saving for these patients, and they're being used now more so in the second phase. And they aggravate diabetes or cause diabetes. What do you say for that?
Sanjay, I personally feel, as the world has become COVID expert, including me, I've become a COVID expert on every aspect of it. But my personal opinion that steroids should be used very carefully and indicated, which is worldwide indicated, right from WHO to Indian guidelines. There are indications for it, but sometimes we become extra cautious in using steroids in any patients. May not be wrong that almost every Indian above 30 has got risk of diabetes. So think that everyone, even if you're not diabetes, HbA1c or the sugar levels have been normal, you're going to use steroids, that he will have a high diabetes, and that's the case that what we have seen. Only thing is, if you need steroids, please use it. I would urge the clinicians and patients as well. If you need steroids, please take it. That's the need. That need is very important. The blanket use of steroids, we all agree, should not be done. But at the same time, we should not be scared that, look, this gentleman has got high sugars, 300. Shall we use steroids if the patient is having hypoxia and requiring oxygen suppression? The answer is yes, please go ahead and use it. And let's handle the sugar, parallelly. So the question is, every patient should be careful about steroids because the whole metabolic syndrome is, we are picking at the tip of the iceberg, that so-called diabetes, but the huge population has got that. And we have seen in this COVID times, almost like every other person is getting worsening diabetes, particularly by the high-dose steroids.
So according to you, if a diabetic gets COVID, what are the indications of using steroid? And till what point one should not use steroids?
Sanjay, I hope I'm right on that. We all know that what works in COVID is hand washing and prevention. So once I get a COVID within the home, I should be taking that precautions. I know I'm repeating myself. We'll keep repeating that. We all know that why. Number 2, once you get it, the prone position works. Before we go steroids, and prone position works. So before that, please do that rather than jumping on steroids and oxygen concentrator. And once your oxygen saturation is dropping, and if your CT score are higher, everybody in the country won't note CT scan. The young girls are getting CT scan, which I'm a little disturbed about it. So what I would say that if you have recurrent hypoxia below, dropping more than 3%, recurrent drop in spite of prone position, these are the patients who should be considered steroid. That's my word. And then you can start steroids. And the dose of steroids, we need to be also careful. I'm not going to teach non-clinician. We need to be careful about it as well.
Right. So, how to monitor blood sugar in these times now? So,
So
should everyone be monitoring blood sugar, or only the non-diabetes should monitor that?
in some way, I will take this opportunity that it's not a bad idea that every Indians or Asian Indians or the world populations have got large number of diabetes. Not a bad idea to check your blood sugar because you have nothing else to do at home. Checking blood sugar, is not a bad idea to do. It says something which you have learned. Sugar we knew, the blood pressure, the pulse oximetry. We don't have to ask now. Everybody knows about it. So it's a good idea to do that. The only thing is the accuracy of the lab as a diagnostic measure is not good. So I will recommend that people should be doing the lab glucose if you have not been diagnosed diabetes. If you think you have got higher risk of diabetes, you should do the lab glucose. If you're not getting COVID today, you might get tomorrow. So it's good to have a baseline known to a doctor that if you by chance known to get COVID. Now, if you happen to have COVID, you must get at the baseline test. So many fancy tests are being done, but missing HbA1c, which is a 3 month sugar control and very diagnostic test, and a simple fasting glucose should definitely be done as part of the initial investigations in all COVID patients. But routinely, we all know that, you are eye specialists, how much frustration you see the retina of the back of the eyes, what 20% can get retina. So the answer is yes, we are more towards it, but I think you should be checking blood sugar very often, especially the higher risk.
So you may find that 2 days from now, all the glucose meters will disappear from the market now.
That's why I don't want that. I think I want people to have glucometer who needs it. So I would say yes. The glucometer, the needles needs not to be shared, but the needles can do it, and the glucometer can be shared. So just to let you know, you don't need to buy. You can take next door's meter and do it. Rather.
So after the monitoring part, now how to manage the diabetes during the COVID illness? Somebody who has diabetes, or somebody who's newly discovered, somebody who's been in control, or somebody who's been out of control. How to manage diabetes in this time?
I would forward first question, front foot to Ritika. I think let Ritika handle the diet first. And then I'll come back. I'm a clinician. We clinicians are very famous.
So that's a very important message that the diet comes first. So Ritika, over to you. Yes.
Yeah. So, so as Dr. Jha said, there are basically two types of patients. And now we've obviously in the hospital, we have so many of our patients who've been calling us up around the clock, even people who are home quarantine or are asymptomatic and all. Even we get a lot of calls from them. So the two types of patients, one, of course, who already had diabetes, and of course, because of the illness, it further gets aggravated, or of course, the sugars are a little deranged. The other subset of people, as rightly pointed out, of course, because of the use of steroids and all, the sugars suddenly go haywire, and you can understand the amount of tension they already are under because of the COVID thing, and suddenly when they prick themselves and they found the sugars are about 300 plus, they really don't understand what to do. So first message is, of course, till the time the steroids are on, the sugars would be a little high. Nothing to worry. Yes, eating a healthy diet, doing a little bit of exercise would definitely help. But the moment the steroids are tapered off, surely if you are following a healthy diet plan, and of course getting back into your normal lifestyles and all, the sugars would be completely normal. So that's one of the important messages which I think the entire population needs to know, because everybody feels that post-COVID they would also become diabetics for sure. So that's one thing. The second is, of course, with regards to diet. Yes, the diet is very important, but remember they're already into a lot of restrictions. They're all at home, quarantine, not too much availability of foods. So whatever is being supplied to them, even when they're in the hospital, the way we supply them the food and all, it is of course a big challenge. So definitely not going into very, very strict restrictions. But yes, certain things I think which is not only for diabetics, but for the general populations also, because with the lack of exercise and all of us have reduced the amount of physical activity which we're doing, we really need to consider eating a healthy, balanced diet, cutting down on what is called the refined carbohydrates. And I think as a population, and especially as Indians, we are too much dependent on carbohydrates. So even if I have to snack something right now, I'll probably look out for a packet of biscuits or a bhujia or a bread. If nothing else, I find a bread being very interesting or very healthy. So just take a toast and I feel I've had a very healthy dinner. So those are the things which really need to be restricted, rather than saying completely no to fruits and no to juices and all. So those of course need to continue in a healthy, practical way, but definitely cutting down on the refined carbohydrates would go a long way in controlling the sugar, especially the ones which have got induced because of the steroids.
Great. So basically, it's it is the same principles which the diabetics are told about beforehand also. They just need to be more careful about the same thing during this COVID period, and not just diabetics, but other population also, that don't eat, pure sugars or refined sugars, as you said. Fine. So, diet being managed, how to manage it by the drugs, Rajhan?
Sanjay, one thing I want to say that if you would have this interview in May, this chat, not interview, this chat, I would say, look, no point controlling diabetes because you are in the middle of the mess. Controlling diabetes would not make a difference to it. Now this is going to be on and on. It's like become a chronic COVID now. So I would say that those people entering the hospital with a blood sugar HbA1c of 7, which is a marker of glucose control compared to 10, the 10 are doing much worse. So even among diabetes, patients have different classification. So now I'll say that, look, if I don't have diabetes, if I have diabetes today, I may get infection in September. I have enough time to speak to my local doctor, local physicians, diabetologists, endocrinologists, dietitian, get back to the business, go back to diet, exercise, basic, what I've been told for last many years. So it's not that we don't have time. So for example, suddenly caught with the malaria, you don't have time to improve the diet. Now we know that tomorrow it's my turn possibly. That's where it is. So what I'm saying that it's very important to get into that habit of, celebrating Eid not every day, but make sure you do the diet on an everyday basis. So, there's always a thing that immune response, how can you improve the diet? I'm sure Ritika gets 1 million questions. How do you improve immune response? You can't. What you have done for last 50 years time can't be changed overnight, and your immune response would go overnight better. So what you have been diet, exercising, and the clean air behind you, Sanjay, that also what matters. So what is important is the overall, what you have been done in the past. It's also important that, for example, that if you happen to get COVID or you may get COVID, what to do? You can't improve your diet overnight. There's a restriction, as Ritika was talking about. So I personally feel that medications and complying with the medications and speaking to doctor is important. I know that sometimes Delhi doctors are busy or Mumbai doctors are busy, but there are opportunity to contact us or contact any of your local physician you have been. GPs are smart enough to start initial medication for diabetes, which is very standard, which I'm not going to talk about the drugs, but drugs are important. If the drug's not working, insulin is important. So it's very important to get your sugar control. Now, what should be a sugar control? I can broadly say that somebody who has got diabetes, the fasting should be 90 to 110 milligrams, and after meal should be less than 160 to 180 milligrams. And your HbA1c should be broadly under 7. In those people who are watching in millimoles, it's something like 4 to 6 millimoles and less than 8 millimoles. So that I would suggest that, sugar could be better controlled, should be better watched. If you're getting an HbA1c of 6 and 6.5 below, you don't have to do the finger prick. If you have not been tested, so those people, I must correct, can do the finger prick. Otherwise, the diet, the exercise, which I'm sure we'll talk later, the medications and taking the compliance of the medications is very important because of the lockdown and not exercising enough, your medication requirement is good enough. I must tell you, the diabetes medications are safe, and all has been proven that all the diabetes medications in the COVID times, there's a long series of data that none of the diabetes medications have worsened COVID per se.
So would you say that people who are diabetics, non-diabetics, and they know their treatment, they should just become more compliant towards the same and also keep a watch on their diet as well as on the sugar part? And in case they find that it is still going out of control, they should consult their physician, any physician, and have the dosage adjusted. Many times they are themselves intelligent and experienced enough to monitor their own dosage as well. So would you think that it's an okay idea for them to change the dosage themselves?
I think so. There are a couple of medications, we call it sulfonylurea, which as long as you know and you have discussed with your diabetes educator and doctor, the answer is yes. If you have not discussed with diabetes educator and trying to Google and trying to adjust the medication, the answer is no. But if it has been discussed with diabetes educator and your physician and your endocrinologist or physician, yes. What to increase, what not to increase, because you can't go supramaximal dose.
Right. So what if the people who develop diabetes or deranged blood sugar in this period due to steroids or otherwise, and they have to be started on medication afresh? So who should they consult for that? The treating physician or anybody else?
I would say that, the workload of across the board trying to contact. So for example, somebody in Delhi, living in North Delhi and been in touch with the physicians, most physicians understand diabetes treatment very well. And especially if your HbA1c and the sugar control has been reasonably good, I would say, then upgrading the medications and preparing for the patients to watch the blood sugars. As you were discussing, Sanjay, the phase 1, any infection to sugar would go up. The problem happens once the steroids is added. So in that phase 1, you can monitor the sugar, adjust your medications, possibly oral or insulin. If sugar would go up, we call it sick day rule, even before COVID, that any infection, you keep monitoring your blood sugars, keep yourself well hydrated, keep checking your blood sugars. Now, once your blood sugar starts going up, that's the point you discuss with the physicians or diabetologist or endocrinologist and consider much different treatment. In some cases or most cases of steroids, for known diabetes, almost all would need insulin who have got diabetes. I may be plotting a very blanket statement that those who have diabetes requiring higher dose of steroids for longer period may require insulin. For that, you need to be a physician who can understand insulin, who has got experience of insulin, or diabetologist and endocrinologist.
Great. So that was actually going to be my next question, that oral treatment versus insulin. You already answered that pretty well. And are these diabetics more prone to the secondary lung infections, especially when the steroids started?
The answer is yes. I would say more lung pneumonia and bacterial pneumonia and fungal infection, which is the topic of the week this week. But yes, they are much more severe syndromes, and they tend to have much more worse outcome. And that's been case for anything. Even your case, the patients who are operated for other reasons, for non-diabetic complications, the diabetes patient tends to be much worse. The answer is yes. Unfortunately, yes.
So you mentioned the word fungus, and we are hearing a lot about black fungus or the mucormycosis now, and it's far more common, and it's come as a big surprise that it's so common in this wave. It wasn't so well known in the previous wave, and though we deal with diabetics day in day out, diabetics get operated, they go to the hospitals also, they receive oxygen as well, but the incidence of mucormycosis has suddenly shot up many folds. What do you think would be the reason for that?
So, Sanjay, I'll take a few minutes for this answer.
Yeah.
Sanjay, if you ask me what case you have seen in last 1 month, I'll not say type 2 diabetes, which is HbA7. I'll say all the odd cases that I've seen. And that's what the way clinicians behave, rightly or wrongly. If I ask you what you have done, cataract, you will say, no, I've done a very rare vitrectomy or something, or odd glaucoma with this. That's what we tend to remember. This is not in relation to what your question asked. So we clinicians have that tendency to talk about those cases which is not run-of-the-mill cases, like type 2 diabetes or metformin. I would not discuss on this platform. So in general, we tend to talk about it. Once we find this, now there are 2 reasons that why we clinicians, including the common first name Sanjay, Dr. Sanjay Sisdeva is talking about mucormycosis or the black fungus, is mainly because there have been, they used to say 10 cases a year. Now they have seen 10 cases in a week. So that's a problem. Now the amount of COVID-19, the number of cases and the steroids, almost like everyone with the COVID-19 is getting steroids now. Right or wrong, I'm not sure, but I think it's partly wrong. And they're getting not steroids for such a short period. Mind it, the Oxford study, the UK study was dexamethasone for 10 days. We are extending it for longer. I'm not saying all of them need it, but that's making them much prone to have fungal infection. The question is, the fungal infections are fine. People do get fungal infection. The question is, in going through your nose pathway, through your heart pathway, and your brain pathway, and that tends to spread. And I just had a chat with Sanjay. She has seen a couple of cases with a poor vision. So they can be very nasty. That's why we are worried about it. It's not that millions are getting COVID and thousands are getting these fungal infections. I think it's not true. But even if it's hundreds are getting, it's a life-threatening eye visions, getting into the brain and affecting their quality of life. And some people have lost one eye or both, some of them. So it is a very sad thing. The sad thing is that you recovered from the COVID. Now you get post-COVID syndrome and getting a fungal infection. That's why you should be worried about. So the prolonged use of steroids, if you have got diabetes, if you have any any organ transplant, if you have cancer, I'm sure the immunocompromised word everybody knows now. We should be very careful on a prolonged use of steroids. If you get any headache or any nasal discharge or any vision problems or prolonged fever after COVID, and you're taking steroids, and also you have a nasal cannula, that can make more of a fungal infection. One thing I'll just put to you, but I'm putting it very crudely. Put a nasal is a plastic tube, put under the nose, and keep it outside for 4 days. You'll have a fungal infection. So as simple as that. The nasal cannula being kept, not being changed, not being washed with high diabetes. Now, talking about the sugar you asked me earlier, that high sugars is the right culture medium for this fungal infection. We are throwing a lot of antibiotics. The bacteria are dying because patients are on antibacterial, and the fungal infection is growing because of high sugary environment. There's a foreign body or a plastic tube, and patients unwell, not mobile, not coughing a lot, and lying down, and immunocompromised post-COVID. So that's why we're getting a large number of cases. Yes, the number is much than we would like it to be. And those patients with diabetes and on steroids needs to be extra careful of any new symptoms, like any pain around this area, any nasal discharge, any problem with your eyesight, or any fever. You must contact your doctor.
Great. So that's a very, very important and strong message. So let's come to the point where somebody is recovering from COVID or has recovered from COVID. How to deal with the diabetes at that point of time? What are the things to be taken care of? Do we need to decrease the medication? Do we need to change the diet or do something different?
So I would say calm down a bit. Thank God. Bach gaye. I'm sorry to put it straight away. We can't put the stress. The poor guy goes into that 12-14 days of hospital admissions, steroids, doctors with all this mask, wearing them. So I say, okay, fine. Take a big step backward. Hopefully you can start walking within the home, which I'm sure we'll talk a little more about it, and obviously control the diabetes. But once your steroids are taken off, it's like taking a chair underneath me. So once the steroids is cut down, the oral medications or diabetes insulin needs to cut down accordingly. And that's the very tricky bit. It's a challenging for me, whom I think one of the smartest doctors in the world. I find it very challenging to cut down steroids, to cut down insulin, matching with the insulin dose. Patient starts eating well, the appetite, the tongue is better. So there are a lot of things starts getting into the play into the diabetes. But that's a period we can gradually control the blood pressure, control the diabetes. Since that goes into the prolonged period, we all need to get into it. But yes, that needs to be controlled, and make sure if you are taking insulin and if your steroids is tapered, you must inform your physician. You must inform. Maybe you can take a steroid day extra if you're not able to inform your physician and cut down the insulin. Or your physician might have told you to cut down the insulin dose, then cut down the steroids. Because if you cut down drastic steroids, the sugar would fall and you will have difficulty in managing at home.
So now let me put it the other way around now. So you are diabetologist and endocrinologist, and we all know that the steroids would be tapered down. But how fast can this tapering down be done in COVID? And how soon can you stop the steroids, keeping all these things in balance, that sugar should be in control, your pituitary axis should not be affected also. So what are your recommendations on that?
I think very good question. A sharp, short steroid course is not harmful, and you can big bang and cut off. So I must tell you that dexamethasone, recommended by the UK and WHO, is 6 milligrams, equivalent to 32 methylprednisolone. Now, if you give someone dexamethasone 6 mg or methylprednisolone 32 mg for 7-10 days or 14 days and suddenly cut off, no big deal. You can suddenly cut off, you don't need to taper. Now, tapered is done because the pulmonologist or physician was not sure about the saturation dropping. That's one problem is. So I'm talking about just sharp, short course of steroids taken for 10 to 14 days, suddenly cut off. Now, if you're taking methylprednisolone or prednisolone 10 mg for 3 months and you stop suddenly, that's much worse. So 10 to 14 days cutting off, no big deal. If you're going beyond 2 weeks' time, gradual tapering off over the couple of weeks' time, over a month is no big deal. You can go a very small dose and cut it off. But high dose suddenly stop, because our onco colleagues, cancer specialists are doing it. They do high dose steroids, suddenly cut off. We don't have problem with them. The problem is that if you say medium dose for long. So what Sanjay is talking about, because your body produce your cortisol, and we should allow them to wake up. That we call it, HP axis. Don't go into the complexity. So our cortisol should wake up. Now, if Once I take steroids, body starts, the steroid axis is sleeping. Now suddenly I've been given large amount of steroids. My body is sleeping. My steroid cycle is sleeping. And they said, I don't want steroids. Let me sleep. The whole cycle, the adrenal gland is not waking up and is quietly sleeping. So let this guy have his own steroids. Now suddenly I stop it. If I've been told to sleep for 14 days, I'll wake up suddenly. But if I have been given long dose of steroids and suddenly withdraw it, the adrenal gland would not wake up. It requires a bit of slow, gradual weaning off of steroids. That's what Sanjay is talking about. So that's why the steroids we do produce in our body, we need to gradually taper it off if we have been using for longer. But if you are using a high dose or moderate dose for 7 to 10 or 15 days, suddenly stopping, no big deal in majority of the cases.
So this is a very, very important message for the masses as well as for the physicians that I say a 2 weeks course of steroid, even in moderate to high doses, can be stopped suddenly, and it actually works better for the control of diabetes and the endocrine system. Fantastic. So that brings us to another important aspect, and people often have a lot of queries around that. That is vaccination in diabetics now. So is vaccine safe for diabetics? Should diabetics go for vaccination? What kind of vaccination do they go for? What are the precautions required? Let us know about that.
How many times am I allowed to say yes? 100 times? 100 times yes. 100 times yes. Vaccination is safe. Whatever vaccine you get opportunity, any Covishield to Covaxin to Sputnik to Moderna to Pfizer, they're all safe in diabetes. And as we were discussing earlier, there are more reasons for them to get vaccinated. That's what the government of India planned, that any diabetes above 45 should get vaccinated. Vaccine is absolutely safe, even if your blood sugar is higher. I get 10 messages a day. My blood sugar is 300. Can I vaccinate? I'm in the queue. I said, first, don't talk to me. Get the vaccine and talk to me later. So please go get your vaccination done, irrespective of your sugar control.
So it's an important message that not only diabetics can get vaccinated, but they must get vaccinated. It's more important for them to get vaccinated than for the non-diabetics. So regardless of sugar level, regardless of the control of diabetes, regardless of what medicine you're on, whether you're on oral medication or insulin, you must get your vaccination done. Any particular precautions they need to take?
I would say no. Why should they take it? Why not others should take it? The vaccination is, your kids had it, my kids had it. We all have been getting vaccination. Yes, I know there are talks about, a few millions getting, 6 people getting CVD, cerebral vein thrombosis, but there's no data on diabetes. There's no data on diabetes of hypercoagulable state. If you had a heart disease, you're on a blood thinner, people used to worry about stopping blood thinner. I would say that standard of care, majority, I must say that I'm not prescribing this to all the population in the country or outside, but I would say that majority of the patients, if you're not very complex patients, you should get vaccination, continue a standard treatment. If you get any extra swelling in the arm, go back to physician. If you see any extra bleeding, go back to your physicians and discuss about it. But you continue your blood thinners, continue your diabetes treatment. I would say that most people need vaccination. They need to be protected more than anybody else.
So even on the day of vaccination, they should take their medication and their diet normally.
Correct.
Great, fantastic. So that brings us to the other aspect, and Ritika has been lying, just dormant here, So Ritika, tell us about what sort of a diet should people focus at these days, whether they're diabetics or they're non-diabetics. I'm not talking about the COVID patients, otherwise, because people are homebound, there's a lockdown, there is stress, there's anxiety, there's fear all around. So what is your advice on the diet for people?
Yeah, so so there are again 2 categories of people. So we're talking about one category where, of course, they do not have COVID, and they're just home. They're at home because of the lockdown, etc. Right? So 2 things to be understood is, of course, one, the physical activity is drastically come down. So there's no physical activity. So definitely the requirement in terms of calories, macronutrients have obviously been much lower. So definitely they need to reduce the quantity of food which they're eating. But simultaneously, at the same time, very equally, what is important is look into the quality of food which they are eating. And of course, over this entire pandemic year and a half now, we've been talking about how to build up on your immunity and how diet plays a very, very important role. And of course, as Dr. Jha said, it doesn't happen overnight. It's an ongoing process. So it's never too late to start on a healthy dietary regime. It will help you in the coming years for sure. So definitely eating a quality food is very, very important. Certain important nutrients to look into for is, of course, proteins for sure. That will not only help in probably making you more energetic, reducing the chances of infection, having building up an immunity, but at the same time, most important is that it will also help you to lose weight, because you cut down on your carbohydrates and fats and you concentrate more on your proteins, you'll probably build up on your muscle mass more, and in terms probably lose weight. So that's one thing. Second, of course, a lot of focus on micronutrients. So again, rather than just taking on these supplements, which of course all of us have been doing on and off, but why not get it from the natural sources? So yes, a lot of emphasis on fresh fruits and vegetables, which will also help you to control your diabetes if you have, because that will give you fiber. It will help you with your weight loss because it is giving you a lot of roughage and bulk, and also giving you all the vitamins and minerals, which of course we've been talking along. So be it your vitamin C and vitamin A, which we know, of course, are the nutrients everybody is looking for. Similarly, a lot of emphasis on nuts and seeds, and I really want to emphasize over here, especially for people who are at home, working from home and all. You generally tend to see people wanting to munch, on certain snacks through the day. So they will reach out to biscuits and bhujiyas, and all the junk starts coming into the house. So this is the time when you really probably can change into your dietary pattern, start looking into healthy options. And nuts and seeds are one of the very, very important food items, which I think for long has been completely missed out from our plate. Very good sources of protein, very high on fiber, very, very rich in the micronutrients, especially whether we're talking about zinc, whether we're talking about selenium. And of course, it becomes more like a habit. So, we've all grown up, like with our mothers giving us badam kha ke school jana and all. So we just have to get back into those, old habits of ours, those good eating habits, and making sure that the children and the adults are having good portions of nuts and seeds. And that will actually help them in not only building upon their immunity, but also help them in eating a overall healthy, balanced diet. So this is, of course, for the people who are at home working, quarantine, and of course not suffering from COVID for sure.
Ritika, a question came in the chat that people take a lot of preservative-based juices now.
Yeah. So
is it advisable for normal people, advisable for diabetics or not?
So definitely not for diabetics, but even for the normal people, it's not advisable. If you start reading the label, you actually see that probably a 200 ml of a juice, which is the Tetra Pak, which is available, has almost about 15 to 20 grams of sugar in that. So it's not, so if you're taking 200 ml of sugar, you're actually taking 4 to 6 teaspoons of sugar in that 200 ml. So just imagine the amount of simple sugars which are just going inside. Yeah. So therefore, definitely it's not recommended. Yes, no harm in having your normal fruit juices, or of course, even when we talk about the Tetra Pak juices and all, we have something which is called a 100%, 100% juice, no added sugar. So as consumers, we obviously have to be a little more vigilant while we are picking up stuffs from the rack, and you will get everything available on the shelf. It's just that you have to read the labels before you pick up. So definitely preserve, sugar, the sugar-based juices which are available are a no, not only for the diabetics, but also for the healthy population as such.
And I would say at this stage, the message should be that why don't you take whole fruit? Rather than taking juice, it's better to consume the whole fruit. It's got fiber in addition to it, and it's much better source of vitamins. Because the moment it's converted to juice, many of the nutrients are lost in that process.
Yes, definitely, yeah.
Okay, so
Sanjay, I would add on it. I बोलता हूँ धरती पे चलो और धरती का खाओ. Ritika must have heard it so many times.
Yes.
So बोलता हूँ, I put it in Hindi. धरती पे चलो means walk simply on the street or wherever you can, and whatever comes from the farm comes to the plate, should coming straight away. That's why, going back to your question, you should be taking more fruits, which is natural wholes.
And this is what I've learned from Dr. Jha, farm to plate theory. That the closer you are to the farm, that means the more wholesome food you're eating, and the less amount of whether it's preservatives or whether it's any kind of processing which is happening, the better it is for the food.
So when one of the programs, Ritika did mention about farm to plate, and I said that why not take the plate to the farm? I mean, it's time that we should actually take the plate to the farm, because and so I think COVID is teaching us a lot of lessons when it comes to respecting and being with the nature. And the reason why I think the COVID actually became a pandemic, that we are far detached from the nature. He's teaching a lot of lessons to eat healthy, to eat natural, to live a natural life, to lead a healthy life, and also to lie prone. That's a big message. Why? Because our bodies, if you look at animals, they always sleep prone. Our bodies are designed to be sleeping prone. We are not designed to be sleeping supine. That's the reason why the oxygenation actually improves when you sleep prone. It's just, again, going back to the basics, going back to the original natural design. So that was deviating from the topic. But so what about diabetics, their diet in this period when they get COVID, Ritika?
So yeah, definitely. So again, people who are not diabetic, but because of the steroids, the sugars have got a little deranged. It is a good idea to monitor the diet, because it will definitely help you to probably get back to your normal sugar levels very soon. So yes, eating a healthy, balanced diet, and of course, not so when I say a diabetic person, it doesn't mean just going off sugars is what is required. We really need to look into the diet in totality, and definitely, as I mentioned earlier, also it is basically the consumption of carbohydrates which makes all the difference. So one is, of course, cut down on the carbohydrates, and that was specifically the refined carbohydrates. It's not that go on to those diets of keto diets and the Atkins diets where you're completely off your rotis and rice and all. I'm definitely not talking about that. You definitely need your carbohydrates in the amount which is as per your requirements of your body, but you should cut down on the refined carbohydrates. So when we're talking about anything is white in color and cereal, so any anat which is absolutely white in color, whether I'm talking about maida, whether I'm talking about breads, whether I'm talking about biscuits, so those are or when I'm talking about noodles, pastas, so these are all your refined carbohydrates. And it's not only the diabetics, even for a healthy individual, these are not recommended, and probably sooner or later even a healthy person would probably precipitate into a metabolic syndrome, or going further get precipitated as a diabetic. So cut down on the refined carbohydrates, very important. The second is, of course, specifically during the treatment of COVID, we do emphasize a lot on protein rich foods. One, it will help you in a quicker recovery. It will help you to get back your muscle mass. There is a little loss of appetite during the a phase where where the temperatures are high, and of course in the acute phases, so the intake drastically drops down. So we really want them to come back into the recovery phase where we do emphasize a lot on proteins. It'll have dual benefits. So one, definitely it'll help you to control your sugars because you're substituting your carbohydrates with proteins, and second, of course, it will help you to regain back your muscle mass. So proteins are very, very important. Micronutrients, very, very important. So look for fruits, vegetables, look for nuts and seeds, and you will get all your micronutrients, whether we're talking about zinc or vitamin C or your vitamin Ds, etc. So the moment you get into these basic food ingredients, and these are all naturally available, easily available, locally available. So you don't have to go for these exotic foods or things where you really have to look for them. These are all locally available. If you get back to eating these basic things, I think the sugars would be very, very well controlled post the recovery of the COVID.
So we talked about post recovery. So would you recommend the same kind of diet to be continued after the COVID phase in the recovery period also? Because people are experiencing a lot of weakness in the body, lethargy, and they lose weight also. So what should they eat after recovering from COVID?
So post-recovery, of course, I think the diet plays more important role, because during the acute phase, there's so many other things in their mind, whether it's measuring their saturation or probably measuring their blood sugars or doing their, testing for their blood pressures, etc. So during the acute phase, probably, yes, eating just a healthy, balanced diet and making sure that the food is absolutely clean, hygienic, and of course safe is what we are basically focusing on. But yes, definitely post recovery, once you're back home, or even if you were at self isolation and you've now completely recovered, you really need to monitor on your diet for the next a month or so for sure. And I think why a month or sure? If you got into a healthy lifestyle, I think this is the right time to get into this lifestyle for the rest of your life, so that going over, moving ahead, you'll probably have a better immunity to fight any kind of those kind of a viral or a bacterial infections probably we might have to face in future. So yes, the diet does plays a very important role, but yes, post recovery emphasis is on a lot of hydration for sure. Make sure the sugars are well controlled, so cut down on simple sugars for sure. Eat a good high protein diet. Definitely, along with the natural fruits and vegetables which we've been talking about, there are a lot of supplements which are being recommended because the requirements are much more than your recommended dietary allowances. So definitely, you need to take these supplements for at least a month or so post recovery, and then of course gradually taper them off and get back to eating most of these supplements from your natural sources. So yes, the diet does become very important post recovery for at least a month or so.
So how important is it for the diabetics to be in touch with a dietitian or a nutritionist, in this period and afterwards?
So yes, I've started getting a lot of patients, especially who were diabetic or probably during the onset of COVID because of these medications that become diabetic, have been consulting us on onlines, etc. So to monitor their sugars for sure. And so yes, it is very very important because as Dr. Jha said, we really need to taper into the medicines also. So even if you're looking at diabetes medicine, if somebody was not a diabetic but was put on diabetic medication during the treatment, needs to be tapered off once the medicines are off, especially the steroids. So if you have a good control of the diet and be able to maintain your sugar levels, and of course that the only way to do that would of course be changing your lifestyle, and that does not only include the diet but also getting into a healthy lifestyle. Your sleep patterns, your exercise, all are an integral part if you really want to be really healthy and control your diabetes.
I think of people who lose their smell and taste in the COVID period. How do they experience food, and what is your recommendation for them? What kind of food they
We
should
like it. We
Yeah.
like it.
No,
We
no.
don't need less.
Interestingly, this phase we did not have so many. It's been different. So last year when this COVID had set in, we had everybody complaining of loss of taste, right? But interestingly, this time.
Okay.
Very few people who actually complained of a loss of smell and taste. So last time, of course, we could, especially I'm talking on a lighter note for our hospital admitted patients, we could say that, it's because of the loss of taste or smell that, you probably are not finding the food tasty. But this time we had a tough job in hand because we did not see so much of loss of taste and smell. But yes, it is one of the symptoms, and we do get to see. And of course, they are not able to smell this specifically while they're tasting. They're not able to taste the sweetness and the bitterness. But yes, they do have a citrus. They can take a little bit of the citrus. They have the feeling for the citrus. So yes, they like a lot of salads, and having a little bit of lemon squeezed into that, a little bit of crispiness does help them. So, I get to hear a lot of time dietitians, or nutritionists speaking online, talking about having absolutely bland food and khichdi and dahi and all. So we do not talk about that at all. So they can absolutely eat a normal, healthy food. They can have all the salads, and they can have their roti and dal and sabzi, and even they can have their non-veg, etc. Until and unless somebody is complaining of gastritis. But eating absolutely healthy, normal food is what is recommended, even if somebody is under treatment or having COVID, and even is admitted in the hospital for sure.
So that brings me to my favorite question. What about the comfort foods? People are going through a lot of stress and they're homebound, and there is anxiety and tension and a lot of
Yeah.
negativity all around. And people want to have to enjoy the food, want to have some comfort food. So what would you allow them to enjoy?
So, we are more than happy to, allow them to have a little bit of dessert and a little bit of sweets, etc. But there's so much of tension and there's so much of anxiety in people, and that fear of their sugars getting high, and probably they might, after COVID, they'll become diabetics for life, is something which we have to tackle day in and day out. So even speaking from my own experience, even in the hospital, even if a person is not a diabetic, he loves having dessert, he'll specifically give me a call to say, don't send me meetha, because I've heard that post COVID everybody becomes diabetics. So I just want to tell everybody that it is a phase, yes, because of the kind of medicines and the kind of treatment, the sugars might get a little deranged, but that is only for a short period of time. Eating a healthy diet, eating everything in moderation, and that does include your desserts, enjoying your scoop of ice creams once in a while is perfectly all right, and we just need to get back to normal eating as soon as possible.
And also, I think it's time to also retrain our smell and our taste to seek fun in eating fruits and vegetables and some salads and all, and they can become our comfort food as well. It is only a question of retraining your psyche about it. Another important aspect of sugar control or leading healthy life in this period is exercise. And so, Ritika, you being into fitness also, so what would you recommend for the diabetics, whether they have COVID or they don't have COVID, what the exercise part?
Yeah, so again, very sad but true. Everybody has stopped. So I think we've gone into this phase of initially when the last time when we had COVID last year, a lot of people had got into a lot of physical activity, online programs, setting up a little gym at home, and everybody was actively involved in, a lot of weight training exercises. In fact, in the initial few months, we saw a lot of people losing weight, their diabetes getting controlled and all. But yes, I think it's stretched too far and too long, so that's why people have gone back to their normal routine, and they've given up everything. So now, of course, when we get to interact with our patients or even with my families and friends, everybody stopped on their activities completely. And I think over the last few weeks, because of this fear that probably it's now become a airborne, people have actually shut down on their windows and the doors, and they've all completely restricted themselves into the house, not doing any kind of activities. So I really want to emphasize over here, it is very, very important that you must continue with your exercise regimen. Yes, you probably cannot go out for long walks, cannot go out to the parks because of the lockdown, but whatever space is available, even if it is your veranda or if it is your terrace, please make sure that you're doing some kind of physical activity. That is very, very important, not only for diabetics for better sugar control, but even for people who've recovered post-COVID, because there is so much of muscle loss and there's so much of weakness in the legs that if you do not get back to a regular exercise regimen, the recovery would take much, much longer time than usual. So it's very, very important. You don't have to do it for longer spurts of time, like an hour of exercise and all, but even doing short spurts of about 5 minutes, 10 minutes and all, and doing it at equal intervals would be equally beneficial for sure.
Dr. Jha, what is your opinion about exercise? Yes,
Yeah.
Dr. Jha.
I must add here, I'm opening my doors and windows much more than before. If there's a problem, possibly the ventilation system, and there are a lot of things to talk about. So I'm leaving my doors open. One thing is which we have seen, I'm sure Ritika and you'll agree, that within the home, the infection rate is higher. Almost 4-6 family members all got COVID.
The entire family is getting infected. Yes.
Exactly. So it's very important to keep door opens because they left the door open. It's very important to leave your door open, leave your window open. It won't travel. If it's traveling in the air, you're all dead. It's gone that far. But yes, it stays in the air. It means that I am in the office and I walk away. You come 2 minutes later, Sanjay, then you can get a COVID-19. It's not like it'll just float in the air in Delhi ke hawa mein, ya Patna ke hawa. That's not there. So just be careful about that. And a couple of points I would like to add on. Sanjay, you're talking about sleeping prone. I unfortunately, my Mossy wasn't well, and I spoke to her son and said, and she just recovered. Hopefully, she's fine today. And I told her ki prone position. So she asked me in a Mathli, "Bacha petkonia." There's a language you will probably know, and I said, "Ha Mossy, petkonia letna hai." Petkonia is a word. It means lie down on the tummy. And most of you understand from this Gangetic belt would understand this word very better. So Sanjay, you and me who've been lying flat after a full glass of whatever we take in the evening with a mutton curry and a kebab and a rice, we can't lie on the tummy. People from the basic villages background used to eat dinner at 6:30 p.m. and can lie down on the tummy. We and you and me who sleep late at 10 p.m. and have all whatever we do wrong things can't sleep on the tummy. And believe it or not, I need to watch, and I think I'm very excited about it, how many people sleep on the tummy in rural India. Very interesting, and I'm sure we need to watch that because my Masi could get it straight away. I said, okay, this is what I have to do. But I said, I just have to tell her, make sure you're awake. Don't sleep, because people sleep on the... So one thing is there. The question is that if you prone position, if you have full tummy, if you're eating late dinner, you should not do that. So be careful. You should be trying prone. That's what I'm sure some of the yogasans and asanas have been telling us. Second point I want to make it about the comfort food. I'm a good cook and I make good masalas. There's two problems with the masala. Namak and tel, oil and salt. The rest is good. The rest are herbs. Tomato or chicha or garlic, all are good. Ritika would agree. I've got Ritika in front of me. I can't do anything wrong. I can't fool people. So one thing is there that salt and oil is bad. The masalas are good. So please enjoy those food which can have a bit of masala. Yes, spicy can make you too much spice. We all know. So that's something I want to add. Third thing I wanted to say that, that One thing, the weakness, I'm taking just last couple of minutes. If your weakness is better from Monday to Tuesday, don't worry about it. People say, Doctor Sahab, kamzori hai. And sometimes it's very difficult to give attention to diabetes or other aspects. Saturation kitna, Doctor Sahab, kamzori hai. मैं पूछता हूँ, आप कल से बेहतर हैं? अगर आप कल से बेहतर है, आज बेहतर है, Wednesday बेहतर है, Thursday बेहतर है, thank God you're better. So the kamzori होती है, if you have weakness, if you are better day by day, any illness for that matter, you had a big surgery, small surgery, COVID, no COVID, you are better. So just don't worry too much on the weakness. It would remain, any prolonged illness will have weakness as long as you are better. So that's why I wanted to add on quickly on this point, Sanjay. Sorry to take you.
Fantastic. So I think we are coming towards the end of our program. So I'll ask Ritika what is your final message for everyone, especially diabetics in these days?
So I think each day teaches us a lesson, and this pandemic has also taught us a lot of good things and bad things for sure. So the good things, I'm sure we should take them and learn them for life. So one is, of course, eating healthy. Make sure that you're eating healthy throughout. Whatever good habits you've incorporated during these times, please make sure that you do not leave them once we get back to a normal routine, which I'm sure would come up very soon. Second is, of course, do not forget to exercise. And I think why did we get to see so much of comorbidities and so much of mortalities and all is because of the kind of comorbidities which in general the Indian population has. And it's of course got a lot to do with your kind of lifestyle you have, the kind of comorbidities you have. So yes, it's a good time for all to think about that how important the diet is and how important is leading a healthy lifestyle, which includes everything. So we've not spoken about sleep, we've not spoken about tension or stress, but that's equally important. And I think changes made now should be there for the rest of your life for sure.
Great. Dr. Jha, what is your final message for diabetics or people who become diabetic as part of the COVID treatment?
It's not a scary disease. Take it as a part of the lifestyle. As long as you diet, walk, exercise, listen to dietitian, we all know what is good diet about it. Check your sugars, be sensible about it. Don't get too scared about it. What will happen to me just because I've got diabetes? Yes, you are a little at the higher risk. Be more careful. One thing I keep saying, when I say higher risk, people driving fast are higher risk. That doesn't mean that you already met an accident. So yes, you're a little higher risk. You need to be more careful, more precautions, more COVID appropriate behavior. Vaccination is important. Within the family, if you get a COVID, somebody get COVID, take extra precautions. Please, please, please. That's what we're seeing bad in this case. Everyone in the home getting COVID. So make precaution, and same to putting in Hindi, dharti pe chalo, dharti ka khao. If not, walk within the home, 5-6 minutes, 6 times a day, becomes 30 minutes walk. Eat healthy as much as possible, and as what Ritika suggested. But take all precautions. We are still not far from this over, sadly.
Fantastic. So thank you very much, Dr. Jha, for coming onto the show and enlightening us with so much wonderful information. Ritika, thank you very much for talking all those wonderful thoughts and ideas and informative stuff. And thanks for taking time out for this show. So that brings us towards the end of show today. So the final message, of course, from me would be that, yes, live as healthy as possible, as natural as possible. Do not be scared. Take precaution. And as everybody is saying, Ritika also said that there's a lesson in this pandemic. There's a lesson in this, what is happening around us. Let us take this lesson. And one of the lessons is to respect nature and to be as close and as much part of the nature as possible, which means leading a natural lifestyle, eating natural food, staying healthy, taking care of your family, taking care of yourself. Not running too fast, not the fast, mad life that we've all been used to. So we need to slow down. We need to slow down so that we should be able to see the red light and stop at the right time and not end up in an accident, as Dr. Jha said, but the fast thing. So life space should also be slowed down so that we actually are able to drive ourselves safer. Thank you very much, all of you, for watching us. I'll see you again next week, same day, same time, with another important topic on Dr. Dhawan's live chat. Namaste.
Okay. Namaste. Thank you very much.
Good night.
Thank you.
I welcome all of you to IBM TV and to this show, which is Dr. Dhawan's live chat, and I'm your host, Dr. Sanjay Dhawan. I'm an eye surgeon practicing in New Delhi. The live chat is a show which talks about any and all aspects of life, any subject, anything that concerns the life or it improves its quality is what we will be talking about. How to plan for it, how to prepare for it. So we'll be talking about all of this. Looking forward to seeing all of you every Friday night 9:30 p.m. to 10:30 p.m. Indian time. Thank you. Bye-bye. Namaste.